Okay, now we can demonstrate the eardrops. So the first thing I need to do is wash my hands. And then I'm going to identify and gather my supplies. So for this medication, I will have gloves, my medication record, my eardrops, and an extra tissue. And I'll use my pen to document my medication administration. So we're going to read the medication label. So this medication is for Joey Doe. We have the Odacort Otic Suspension 1%, and we are going to instill 1 drop in the right ear, and we are going to administer the 2 p.m. dose. We're going to double check that against our monthly medication record. So we have the Odacort Suspension 1%. We're going to instill 1 drop into the right ear, and we're going to administer that at 2 p.m. Here we have the parent authorization form. Jane Doe has signed that we can give Joey Doe 1 drop in the right ear of the Odacort Otic Suspension for an ear infection. Possible side effects that we should know are any redness or a rash, and we're going to give that at 2 p.m. We want to read the medication label to see if there's any special instructions and check the expiration date. This medication is not expired, and I don't see any special instructions. So we'll do our second medication check, and we can ask an assistant for help positioning if we feel like Joey is going to need some help holding still. So we'll do our second medication check. We have Joey Doe, the Odacort Otic Suspension 1%. We'll instill 1 drop into the right ear at 2 p.m. Jane Doe has authorized that we can give the Odacort Otic Suspension 1%, 1 drop into the right ear at 2 p.m. for an ear infection. And that matches our monthly medication record for Joey Doe, the Odacort Otic Suspension 1%, 1 drop into the right ear at 2 p.m. So we can take our medication and our supplies to Joey and explain the procedure. And we're going to have him lay on his left side so that we can administer the drop into his right ear. I'm going to put on my gloves. And if the ear canal has any thick drainage or dry drainage, you want to call the parent to see if you should still administer the medication, but do not try to remove any of the drainage from the ear. So we're going to do our third and final check. We'll check our medication container. It says Joey Doe Odacort Otic Suspension 1%. We're going to instill 1 drop into the right ear, and we're going to give the 2 p.m. dose. We have the medication authorization form signed by Jane Doe that we can give Joey Doe the Odacort Otic Suspension 1%, 1 drop into the right ear at 2 p.m. for an ear infection. And that matches our monthly medication record. So we are going to position Joey, and we are going to pull on the outer aspect of his ear, and we are going to pull out and down, and that will help to open up the ear canal. We will administer 1 drop into the ear, and we're going to avoid touching the tip of the medication container to the ear. And we're going to give Joey a tissue that he can blot any excess medication, and he needs to lay on his side for several minutes. If there's to be a dose of medication administered into both ears, you just need to make sure that the child remains on their first side for at least 5 minutes. Once you're done administering the medication, you can remove your gloves, wash your hands, replace your cap on your medication. We're going to document that we administered the 2 p.m. dose, and then you can return the medication to your lockbox and any supplies, throw away your gloves and tissue, and then you can clean your medication administration area and monitor Joey for any adverse effects of his medication.